Hello all, I'm Dr. Hema Vaithianathan, fertility consultant at Oasis Fertility, Chennai. So today in this session, let's understand about recurrent pregnancy loss. So recurrent pregnancy loss, one of the treatment offered nowadays is about going to for IVF as a treatment. So let's understand more about how IVF as a treatment option can help a couple who are facing this problem, which is repeated pregnancy loss. So let's understand more about this repeated pregnancy loss and IVF as a treatment option. So let's first have to understand about miscarriage and when it is called as a repeated miscarriages. As we all know, miscarriage is a very common complication in pregnancy, and about 70 to 80% of the pregnancies results in miscarriages even before the implantation stage. And miscarriage is a common problem, but repeated miscarriage, it is called, the diagnosis is made as a repeated pregnancy loss when a couple face at least two pregnancy loss. So when there is two or more failed pregnancies, then the condition is a recurrent pregnancy loss because it needs an evaluation. It needs a proper planning and treatment in the subsequent consumption. So hence it is called a recurrent pregnancy loss medically, RPL or recurrent pregnancy loss. So the incidence is like 2 to 5% of the couple experience this condition, and it could be devastating to have to experience this repeated miscarriages. Here, repeated miscarriages, even after proper evaluation, and even after all the testing, sometimes we may not be able to find a cause of what is causing this repeated pregnancy loss. In that case, it is called as an unexplained problem or an idiopathic problem. In almost like 50% of the time, we may not be able to find a cause as to what is causing these miscarriages. So sometimes in about 50% of the time, we may be able to find some cause as to what is causing the issue and try to address what is all can be reversed as a cause of these miscarriages. So repeated miscarriages or any miscarriages is because of certain reasons can be underlying the causing cause of this miscarriage. And some of the underlying cause and the most common cause is chromosomal and genetic problems in the embryos. So chromosomal problems in the embryos are actually attributed to even 70 to even sometimes up to 80 to 85% of the time. The cause is because of chromosomal problems in the embryos. So these are sometimes random chromosomal variations, and every time a diagnosis may not be made from sending them fetus for an genetic testing. But sometimes genetic testing of the couple is possible, which is known as a karyotyping, as a genetic testing for the couple, for the male and the female. Genetic testing can be done. Sometimes a problem known as a translocation type of genetic problem can affect the way the embryo is formed, can affect the embryos genetically. And if that genetically abnormal embryo, even if it implants, but the conception may not be healthy, and it may result in miscarriages. So what we have to understand here is that in almost 80% of the time, miscarriages happen because of the abnormal genetic composition of the embryo that is conceived. And sometimes it is because of the problems with the uterus, because the uterus is where the implantation happens. So sometimes the problem is because of the unhealthy uterus. So what all problems can happen in the uterus? The uterine variations can be from its shape. Sometimes there can be uterine defects which can happen congenitally. From that is by birth, the uterus can be abnormal, and some of the abnormalities or congenital anomalies in the uterus are having a unicornate uterus or having a double uterus known as a bicornate uterus, and sometimes there could be a tissue that is inside of the uterus known as a septate uterus, which is like a wall in the uterus that can affect the way the embryo implants and the way the embryo develops into a fetus. In that case, this type of uterine anomalies itself can cause repeated miscarriages in a women, and sometimes uterine acquired problems in the uterus, like having a problem known as an fibroid uterus. As you all know, fibroid uterus can grow in the uterus, and many a times fibroid doesn't cause problems, but sometimes fibroids can be in a location that can affect the fetus growth. and hence it can result in miscarriages sometimes, especially a type of fibroid known as a submucous fibroid can cause repeated miscarriages also. And sometimes it's because of other problems in the uterus, like adenomyosis. If it is in a severe stage, it can cause variation in the way the endometrium or the inner lining of the uterus. It can affect the health of the inner lining of the uterus where the embryo implants, and can cause repeated miscarriages. And sometimes it is because of an immunological problem. So many a times, more and more recent research studies are giving an immunological explanation for us for why repeated miscarriages are happening. So many times we cannot establish an accurate diagnosis when it is an immunological condition that is causing the miscarriage. But sometimes we can do some testing for which some treatment can be done to reduce the risk of miscarriage in the next conception. And sometimes an acquired condition known as acquired thrombophilias can be a problem. And even congenital thrombophilias also can be a problem that is leading on to repeated miscarriages. So hence it is also a part of testing where we test for the presence of these acquired thrombophilias, and sometimes that congenital thrombophilias also testing is also necessary. And other blood clotting disorders has to be ruled out in selected women. And there are other medical conditions also can lead on to this repeated miscarriage problems, like sometimes uncontrolled diabetes mellitus can lead to repeated miscarriages, and sometimes autoimmune thyroid problems can cause miscarriages repeatedly in a women. So it is important that we understand all the causes. When we understand more and more what is causing this repeated miscarriages problem, then we can give an individualized evaluation for the couple to understand the cause and to treat it in order to reduce our risk of miscarriages in the next conception. So that is what is the goal of our evaluation. So, but we cannot give a blanket evaluation of a fixed number of tests that is done for all the couples. The testing is highly individualized itself. So even though we know some of the prominent causes that causes repeated miscarriage problem, we have to understand that also that women's age is the most important factor here. So any women who is above 35, there is the risk of miscarriages increased, especially above 40, there is more risk of having miscarriages. Like after 43 years of age for a woman, trying to conceive itself can be difficult. And even after conception, there is almost like 50% chance of experiencing a miscarriage. Um, so we understood the causes here. So hence, all the investigations are directed to identifying these reasons, underlying causes. So chromosomal testing for the couple is offered as an important testing. The type of chromosomal testing is known as karyotyping. So karyotyping is important for the male as well as the female. They are experiencing repeated pregnancy loss. So this chromosomal testing, this karyotyping, give us insight into whether we are dealing with any translocation as a problem in the couple. Because with one miscarriages, this is usually not a problem. This is not a standard testing with one miscarriages. But two or more miscarriages, this translocation type of genetic issues can be picked up with karyotyping, and hence we can prognosticate. What we can do in our next cycle, next pregnancy. We can even plan to select embryos in that case using IVF. And also, as I said, so there are so many of uterine problems that can lead on to repeated pregnancy loss. And hence, evaluating the uterine cavity is an important test part of evaluation of women experiencing recurrent miscarriages. So this hence viewing inside of the uterine cavity by an investigation known as a diagnostic hysteroscopy, where which we can take in a complete evaluation of the uterine cavity, which is the inside of the uterus. We can do this evaluation known as a hysteroscopy, which help us understand if there are any problems in the inside of the uterus that is causing repeated miscarriage problem. So some of the things that we pick up during hysteroscopy, women experiencing repeated pregnancy loss can be commonly uterine septum, or sometimes it can be an endometrial polyp, or sometimes it is in a submucous fibroid, or sometimes it is some random findings of adenomyosis, or sometimes we could pick up problems known as infections inside the uterus. But some of the problems may be attributed to repeated pregnancy loss. And hence, if we identify any of the problems, it can be treated also in order to reduce our risk. And next is, importantly, we always analyze the basic blood evaluation. The basic thyroid problems has to be ruled out, especially as I mentioned, autoimmune thyroid problems has to be ruled out, because that some of the research studies have proven that having autoimmune type of thyroid issues can affect the way the pregnancy get carried to term. And also sometimes prolactin issues can cause problem. Hence, a baseline hormonal evaluation is necessary for women experiencing repeated pregnancy loss. Also, if a woman who is an already diabetic, or if the diabetes condition is not goes undiagnosed, hence it can result in miscarriages. Hence, it's always important to do a blood sugar evaluation. We also test the hemoglobin A1C to check the presence of any higher blood sugar levels in the past 2 3 months. And also, as I mentioned, acquired thrombophilia testing is also a standard part of evaluation if the couple is experiencing two or more pregnancy loss, like a group of antibodies known as antiphospholipid antibodies. Another group of antibodies that might lead to acquired thrombophilia problem is also tested, so that if a diagnosis is made, then we can take some measures to reduce our risk of miscarriage in the next pregnancy. So all the investigations are directed to identify problems that can be corrected, and that can be corrected and reduce our risk of miscarriage in the subsequent conception. So that is the whole idea. And also for some of the problems that were identified, like translocation in the couples or genetic problem in the couples, then we offer treatment in the next conception is to have IVF and to have an option of selecting the embryos that is not genetically affected in order to increase the chance of a successful pregnancy outcome. So this is about the investigation, and hence we understand here for couple experiencing repeated pregnancy loss, for them conception is not a problem. So we are not dealing with infertility or subfertility here. We are more like we are dealing with miscarriages, but still IVF is offered as one of the best option to consider for couples experiencing repeated miscarriages, because it offers a lot of other options for the couple. Let's understand why IVF is offered as an option for these couples experiencing repeated pregnancy loss. Because with IVF, there is a chance for extensive evaluation for this before trying for the next conception here. So we can identify some of the causes, underlying causes that is causing this pregnancy loss problem, so that we can optimize the health of both the men and the women. So before they try to conceive in the next conception. So with IVF, we can reduce the time to conception. So even though the couple is experiencing repeated pregnancy loss, even here age is an important factor, as I mentioned. With age, and if the time to conception is delayed, there is a reduction in the quality of the egg and the quality of the sperm. That way, it increases the risk of fertility issues. And hence, with IVF, we can reduce the time to conception. And not just that, there are a lot of other benefits that IVF offers. And also, it also helps in certain couples that have certain problems. Like the problem is in the men, because even with men, there is a good contribution from the sperm to form a good quality embryo. Hence, we always do some sperm analysis apart from the basic routine semen analysis. We also check the sperm health with a test known as a sperm DNA fragmentation index. So this sperm DNA fragmentation, if it is increased, the research studies have proven that if in men having an abnormally high DNA fragmented sperms, then there is a risk of miscarriages, especially repeated miscarriages. And hence, with a high amount of DNA fragmentation in sperm, we offer this type of option known as sperm selection techniques in the IVF cycle, so that it helps in generating a good quality embryo that has a higher chance of implantation, that has a higher chance of giving us a good live birth. And also with IVF, there is a chance of using a technique known as an ICSI. With ICSI, we can select a better quality sperm. So with ICSI, also we sometimes we administer this as a technique to enhance the option of pre-implantation genetic testing. So with IVF, As I mentioned, we can use this embryo selection better if we take the option of pre-implantation genetic testing of embryos. And sometimes, if we find a translocation or some structural translocation genetic issue in the couple, then we offer in the option known as a pre-implantation genetic testing for structural relocations. So this PGTA and PGTSR is an important option, an add-on option in IVF cycle, which we offer for couples experiencing repeated pregnancy loss. Because this option, this pre-implantation genetic testing, offers us a chance to identify embryos that are not affected genetically or chromosomally, so that not, if we identify an embryo that is having a normal genetic composition, there's higher chance of implantation and there is higher chance of carrying it to term and higher chance of having a live birth. And hence, PGTA is a very good treatment option for couple experiencing repeated pregnancy loss. And also, sometimes we can add on this immunological treatment along with if there is an immunological association. This also will reduce the risk of miscarriages in the subsequent pregnancy. And also, a lot of support, hormonal support, is offered during an embryo transfer in order to support the pregnancy to reduce the risk of miscarriage. Especially, this helps in an unexplained recurrent pregnancy loss problem. This kind of support this is given in the very early pregnancy stage, that is around the implantation stage. If there is a hormonal support is given, then there is better chance of implantation, better chance avoiding this the problem known as the luteal phase defect and everything. And also with IVF, there is a good early pregnancy care is necessary, especially to identify the health of pregnancy, to identify the implantation as well as the way the early pregnancy is forming. So that kind of an early pregnancy care will give a couple also a kind of reassurance that the pregnancy is going on healthy. So as I mentioned, with IVF, we offer this sperm selection technique because with some of the research studies have proven that that men having increased proportion of DNA damage, then there is higher chance of having a repeated pregnancy loss. Hence, as I mentioned, sperm selection technique is an important add-on treatment that we can give during the IVF cycle. As I mentioned, XC is also one of the indication here, especially when we are considering pre-implantation genetic testing. As I mentioned, pre-implantation genetic testing is an important add-on option that we offer in couples when they take IVF as an option. So this involves taking a few number of cells are removed from the embryos, and these cells are subjected to genetic testing. And once this embryo testing come back as normal, then when we transfer a very normal embryo, which is genetically normal, then there is higher chance of implantation and less chance of having a miscarriages. And also this pre-implantation genetic testing, there are types in this. We can even generally screen the embryos for the presence of chromosomal and genetic problems. Also, we can screen the embryos for a particular problem. Also, in that case, we call it as a PGT-M type of testing. And also, importantly, we also offer this pre-implantation genetic testing for structural rearrangements. In that case, it is offered for selected couples also. So pre-implantation genetic testing, there are so many other indications why we offer pre-implantation genetic testing. But most commonly, it helps couples experiencing repeated pregnancy loss also. And there are a lot of other add-on options also during IVF treatment. It all are highly individualized. For some, the implantation may not be healthy because of the inherent defect in the embryo quality. So there are sometimes implantation is not happening because endometrium is not in the very receptive state, and sometimes it because of the immunological issues that is happening because the embryo is not getting accepted by the maternal tissues. So there are a lot of other options are also available. These are called as an add-on options. This has to be suggested in a case-by-case basis in order for us to improve implantation and to increase the chance of having a live birth. So hence it just doesn't prove to be successful in all the couples. So there are selected. We have to actually have a case by case discussion and analysis, and then offer some kind of nano treatment to individualize the treatment in order to increase the success rate. So I think we have come to the end of the session, and I thank you all for your patient listening. And so that is about recurrent pregnancy loss and how IVF can help couples experiencing repeated pregnancy losses. Thank you all.